Undertreatment of pain is further exacerbated by society attitudes towards opioid analgesics. Tolerance and physical dependence are still being confused with addiction, which certainly influence the way physicians and their pain management is prescribed for patients. The current opioid stigma is a formidable barrier for oncology patients. Our country has punished and even in some cases criminalized addiction. Oncology patients are vulnerable to being undermedicated out of providers' fear of addiction, current opioid abuse law enforcement, and lack of pharmacological education on opioid analgesics. Society's attitudes and norms towards opioid analgesics are hindering adequate oncology pain treatment for this vulnerable patient population. Due to lack of access to sufficient management contributes to poor pain management and patient outcomes. Barriers are in place for oncology patients to get the treatment they need by pharmacists, healthcare providers, and society standards in place. What is it like for an oncology patient who is experiencing cancer-related pain to be undermedicated? Pain associated with malignancy is a critical problem for cancer patients. The majority of patients, up to 85% with advanced disease, report pain. Approximately 90% of all cancer pain can be effectively treated within an integrated program of non-pharmacological, pharmacological, and anti-cancer therapies can significantly reduce patient burden and ease up pain control. Shields et al. Conducted a survey to assess the knowledge of cancer pain and its treatment among physicians in affiliated ECOG practicing facilities. 86% of their patients felt that the majority of their cancer pain was undermedicated. Lack of pharmacological education and inadequate confidence in pain assessments on oncology providers was cited as the major barriers to their pain management. Inappropriate pain assessment, fear of opioid shame, and lack of knowledge can significantly affect the plan of various forms of vulnerable patient population. Older adults, both minorities and underserved, children, individuals that are immunocompromised, and at end stage of life. Attention to the needs of these vulnerable populations are critical to support the transition to early palliative care, such as pain control. The opioid and overdose cultural stigma is counterproductive to oncology patients. It makes patients feel weak and unworthy, undermining any motivation to control their opioid use. Most troubling is perhaps the evidence that the attitude extends into the healthcare system with undermedicating patients out of fear. Many cancer patients are undermedicated and inappropriately managed for pain, leading to a diminished quality of life. Patients with moderate and severe pain require some form of opioid analgesic intervention. Cancer disparities and pain disparities interlap. Their differences interlap and coincide based on the incidence and prevalence of cancer, the mortality and survival rates, morbidity and survivorship, financial burden of the cancer, and its stage at which the cancer was diagnosed. Pain management and the oncology plan of care. The oncology population that may experience these disparities include groups defined by race, ethnicity, disability, gender identity, income, sexual orientation, and various other characteristics. Certain groups in the United States experience cancer disparities because they are more likely to encounter obstacles to access to health care. People with low income, low healthcare literacy, and who lack health insurance are less likely to have recommended cancer screenings, cancer diagnosis, and to be treated for adequate pain management according to current guidelines. According to current guidelines published, the choice of analgesic should be based on the intensity of the pain that the patient is reporting rather than the cancer etiology, which is why adequate pain assessments are critical to proper pain management. During the course of a cancer pain management, patients frequently require change from one or more opioid to another. A different opioid may be necessary as a result of intolerance, side effects, cost consideration, and the need for another alternative route of administration. Physician education on oncology pain and how opioid stigmas can be avoided with oncology patients should be provided to oncology providers. Once this vulnerable patient population receives a cancer diagnosis, they will face and have to overcome numerous barriers associated with oncology. Undermedicated pain should not be one of them.